Welcome back. Today's video is about smoking and plastic surgery. Did your doctor tell you to quit before the surgery? Here's why. An extensive study was conducted with 415 patients that enrolled. They were followed for about 3 months while their recovery process and habits were monitored. We'll get back to the results of that study a bit later, but first, let's answer some questions some are asking about smoking and plastic surgery. Anonymous 1 asked, can I stop smoking 3 days before surgery? The answer is yes. Nicotine is flushed out of your system roughly within 3 days, give or take a day. But it is always better to be prepared, preferably at least a week or more before your surgery. It is also important to note that smoking during recovery is extremely helpful to your recovery. Anonymous 2 asked, what happens if you don't quit nicotine before surgery? Well, you might be at a higher risk for infections if you don't quit before surgery. Oxygen is crucial for healing wounds, and by smoking, you are denying your body exactly that. Anonymous 1 says, me again, can I stop smoking 12 hours before surgery? Your body and your immune system takes a couple of weeks to recover after you quit. But don't give up because you missed this deadline. It is always to your benefit if you quit any time before surgery, but absolutely no smoking for at least 12 hours before your surgery. Anonymous 3 asked, will I be okay if I smoke before surgery? Smoking decreases blood flow, and that causes surgical wounds less likely to close and heal properly, and thus more likely to get infected. Smoking also weakens your immune system. Anonymous 4 asked, how long does it take for nicotine to leave your system for surgery? Usually your body takes 3 days to flush out nicotine and won't be detectable in your urine after 3 or 4 days. But remember, nicotine gum and other NRT products still contain nicotine. Another question from Anonymous 4. And can a surgeon tell if you smoke? Yes, your doctor can pick it up by looking at medical tests that can detect nicotine in your blood, urine, and your saliva. But why do you want to mislead your doctor? Anonymous 4 again. How long after quitting smoking are you considered a non-smoker? The quick answer is within a month to a year. Your body continually recovers, and about after 9 months your lungs would have improved a lot. Now back to the study they did about plastic surgery and smoking. 415 patients were enrolled, and roughly 33% stated that they had quit, and only 9.4% admitted they were smokers. After urine testing, an additional 4% were caught lying as they denied that they were smokers. But the main point I'm trying to make is that smokers had significantly higher complication rates and tissue necrosis rates. Tissue necrosis is body tissue that got damaged, that doesn't get enough blood, and it dies. Necrosis cannot be reversed. These patients also had higher rates of reoperation. Many doctors require urine testing because many believe they can deceive their doctors by saying they quit or they don't smoke. For your own sake, your health and your recovery, quit smoking. It's the right thing to do. If you struggle to quit and struggle with those cravings, schedule a free call with me and let's talk about your goals, and let's discuss how I can help you reach them. There's a link in the description and the comments. Thanks for watching.